Hello, my name is Emily Jacobs. I'm a registered dietitian and the nutrition educator for Virginia Cooperative Extension in Loudoun County. Today, I'll be talking about how to nourish and flourish with HIV. So, just to give you some background on myself, I previously worked in a surgery clinic for bariatric surgery, weight management, and diabetes management prior to coming into the role that I have now and have worked with patients with HIV before. So this is a topic in which I'm quite familiar with, and especially on that symptom management side, we see a lot of overlap between symptoms related to HIV medication with symptoms that we see after surgery, especially those gut surgeries. So I have a lot of nice tidbits to share with that. So to get started, um, I'll be going over an overview of HIV, talk a little bit about nutrition and food safety, talk about symptom management, and then some local resources that are available in Loudoun County in Northern Virginia. So HIV is short for human immunodeficiency virus. It's a virus that destroys the immune system cells that fight off infections, illnesses, and certain cancers. Without treatment, HIV can gradually destroy the immune system, causing a decline in both health and also can cause the onset of acquired immunodeficiency syndrome, also known as AIDS. However, with treatment, the immune system can recover, and treatment options do include retroviral therapy, shortened to ART, which includes a combination of medications that prevent HIV from multiplying. If we're looking at prevalence of HIV in the United States, there's about 1.1 million individuals living in the United States with diagnosed HIV as of 2023, and that is for diagnosed cases. It doesn't take into account people that might be undiagnosed. So then nutrition considerations. So eating a healthy diet can help people with HIV tolerate their medications better, maintain a healthy weight, manage symptoms, and feel better overall. You need adequate amounts of different nutrients in order to build and repair cells, keep your hormones regulated, fight infection, and maintain energy levels. When we're looking at specific vitamins, vitamin D and B12 are key vitamins to monitor with HIV. So vitamin D, it's involved in our bone health and immune function. When we're looking at good sources of this nutrient, we have salmon, sardines, the skin from fatty fish. So tuna, mackerel, when we're eating tuna and mackerel, we want to eat the skin with the fish. We also have beef liver, egg yolks, and mushrooms. And additionally, we have fortified sources of vitamin D with our cereals, dairy milk, yogurt, and tofu. Some plant-based milks might be fortified with vitamin D, so just want to check the back of the label to make sure that it does have vitamin D in it. So looking at some practical applications with eating more vitamin D. So something that I think is a pretty easy way of introducing fish into the diet, if you're not a big fish eater, is by making salmon cakes or fish cakes with quinoa. It kind of tones down that fishy flavor from the salmon or the tuna because the quinoa is a little bit more bland, and you're able to add more spices, vegetables to it to also help tone down that fishy flavor. So that could be a really good option to try out. And lilbroken.com has a really good salmon quinoa cake recipe. Can also make puttanesca pasta with sardines. So puttanesca pasta is a pasta dish in which you have capers, sardines, tomatoes, a lot of umami rich foods. And so it's a very savory dish with that's also high protein that also contains a lot of vitamin D with the sardines used in it. Can also make mushroom stroganoff if you're more on that vegetarian vegan side. And a tip for the mushrooms is if you place them in direct sunlight for an hour, the vitamin D content will actually increase. Because similar to how when our skin is exposed to sunlight, we ha increase our serum levels of vitamin D. So does mushrooms. So that's could be an easy way of adding in more vitamin D and increasing the content in your food. And just another option for our fish is making a potato salad with sardines, the Nordic way. And I do find that the potatoes, the creaminess of it also does tone down that fishy flavor. So then vitamin B12, it's involved in cell metabolism and nervous system function. Good sources of vitamin B12 include our meats, poultry, fish, shellfish, dairy products, and egg yolks. So those are all animal products. So for anyone that's following a vegetarian vegan diet, they may need to supplement with a vitamin B12 supplement, and that's something that you'll want to talk about with your primary care provider or whoever's managing your HIV, so that you're adequately supplementing, getting enough of it. So some practical applications for people that might partake in some of these animal products includes eating 8 ounces of fish across the week, adding in more dairy products to your meals and snacks. So that might be having a parfait for breakfast. It might be having cottage cheese with everything but the bagel seasoning for a snack. Choosing lean cuts of meat, so sirloin steak, pork loin, and I'll talk a little bit more why we want to choose lean cuts as opposed to fatty cuts of meat in a little bit. And then also potentially starting off your day with eggs or yogurt. So some other options for our yogurt, other than a parfait, might be to incorporate it into a smoothie. With our eggs, that might be having some boiled eggs, scrambled eggs, however you'd like to have them. So then our HIV medications can affect our cholesterol, triglyceride, and blood sugar levels. So it's important for us to follow a heart healthy diet, low in saturated fats and moderate in carbohydrates in order to protect our heart. So that's why we do want to choose those lean cuts of meat. Those fatty cuts of meat are going to have a lot more saturated fats in them, which aren't heart healthy. When we're looking at specifics, 45 to 55% of our calories should be coming from carbohydrates. So, that's still 50% of the calories that we're eating each day. So I don't want you to cut out carbohydrates. Just moderate them a little bit, and try to evenly split them throughout the day, just so as to maintain your blood sugar levels throughout the day. We also want to add in fiber. Nationally, Americans underperform in getting in their fiber. So it's important to aim for 14 grams of fiber per 1,000 calories consumed, especially because our fiber is also going to be very cardioprotective. So want to make sure we're getting enough fiber. And then 25 to 35% of our calories coming from fat. So we're not trying to eat a low fat diet. We're aiming to eat a low saturated fat diet. So less than 7% of our calories coming from saturated fats. And then we want to try to meet our omega-3 fatty acid needs because those are cardioprotective. And guess where our omega-3s are? They're gonna be in our fish, so especially our fatty fish like our tuna, our salmon. So some of those fish that are also good sources of vitamin D. So we're getting two for one if we incorporate more fish into our diet. So some practical applications. So as I mentioned before, with our carbohydrates, we want to evenly split them up throughout the day. So depending on how many calories you need each day, you might be having 30 to 60 grams of carbohydrates per meal and 15 to 30 grams of carbohydrates per snack. We want to keep our saturated fats level under 20 grams per day. Add in more sources of those omega-3s. So some additional sources could also be shellfish walnuts, chia seeds, and flax seeds, and aiming for 24 to 30 grams of fiber daily. So then looking a little bit more into sources of our saturated fat. So we're looking at them as the good, the bad, the ugly. So our good fats are going to be fats that are liquid at room temperature, primarily those monounsaturated and polyunsaturated fats. They can help with lowering bad cholesterol levels. They lower the risk of heart disease and stroke, and also helps to provide your body with those essential fats that your body needs and can't produce itself. So our sources are going to be our oil, so canola oil, olive oil, peanut oil, safflower oil. We have avocados. And another tidbit, avocados are also a great source of fiber. You get 7 grams of fiber per one medium avocado. So that could be, a quarter of your daily needs. Our fatty fish are another source, and then our nuts and seeds. With our bad fats, that's going to be our saturated fats, as I mentioned before. So, those can raise our bad cholesterol levels, lower good cholesterol levels, increase risk of heart disease and stroke. And saturated fats are normally found in animal sources, such as in our beef, pork, and chicken fat. So, when we're choosing cuts of meat, we want to choose meat in which it has less marbling, less fat present in the meat. We also want to choose skinless chicken or turkey because a lot of that fat is going to be subcutaneous right underneath the skin. We also want to avoid using a whole lot of butter when we're cooking or baking, using moderation with that. Same thing with cheese. Cheese is a good source of calcium and protein, but it's also a really good source of saturated fat. So we want to be careful with those. And they do make lower fat cheeses that are pretty good. So those are some options to maybe give a try. And then our tropical oils are also a source of saturated fat, so our coconut oil and palm oil. So what I like to think of with our saturated fats is that they're going to be solid at room temperature, as opposed to our unsaturated fats or good fats are going to be more liquid at room temperature. And then our ugly fats are going to be our hydrogenated oils and trans fats because they have been shown through research to increase our risk of heart disease and stroke and risk of type 2 diabetes. They're really not good for our health. And so we usually see that in our partially hydrogenated oils, some baked goods, fried foods, and then stick margarine. So we want to try to limit those or eliminate those as much as possible. So then, as I mentioned before, with our sources of fiber, we want to aim for 14 grams per 1,000 calories eaten, or just a blanket statement could be 24 to 30 grams of fiber each day. We get them from a variety of food groups, so our grains, so mainly in our whole grains, so like our popcorn, our whole wheat cereal, whole wheat bread, bulgur, teff, quinoa, whole wheat tortillas. With our vegetables, we get fiber with all of our vegetables, but some are going to be better sources than others, such as our artichokes, navy beans, lentils, green beans, and jicama. With our fruit, avocados, durian, guava, raspberries, berries in general, pears, oranges, and bananas are great sources of fiber. And then with our protein, we're going to mainly see fiber with our nuts and seeds. And specifically looking at that, that would be pumpkin seeds, chia seeds, almonds, chestnuts, pine nuts. And that QR code at the bottom of the screen just takes you to a list of high fiber sources of or whole food sources of fiber. And it breaks it down into how much fiber is in each serving of those foods. So I do recommend checking that out. And here's just an application piece of, something that hits multiple things that I just touched on. So we have an easy chia pudding recipe where it's high in omega-3s and fiber. You can mix in frozen fruit to it in place of the sweetener to give it that natural sweetness. You can add in some nuts or seeds to boost the omega-3s and fiber, and then also give it a little bit of a crunch. This is just a really basic recipe that you can take and run with and do whatever you want to it to modify it to make it something that you enjoy. So I do recommend giving this a try. And then last thing for our nutrition to talk about is antioxidants. So antioxidants help to reduce oxidative damage and inflammation to keep our body healthy. Tissue levels of antioxidants have been shown to be reduced in people with HIV, and this could be potentially from reduced dietary intake of antioxidant foods or poor absorption of antioxidant micronutrients secondary to a HIV infection. Antioxidant micronutrients include vitamin A, vitamin C, vitamin E, zinc, and selenium. And so, where we usually see these with our vitamin A and C, they're usually found in orange and yellow fruits and vegetables, such as our citrus fruits, carrots, bell peppers. Vitamin E is typically found in green fruits and vegetables, such as our leafy greens, kiwis, and avocados. And then zinc and selenium are usually found in nuts and seeds. And so, one thing that you will hear us nutrition professionals mention over and over again is how important it is to eat a rainbow of fruits and vegetables so that you're getting all of the different vitamins and minerals throughout the week that you need. And by eating rainbow, you're also getting in all of these different antioxidants. So then food safety considerations. Although food safety is an important concept for everyone, foodborne illnesses do pose a greater risk for people with HIV because their immune systems are compromised. So some key concepts that we'll talk about is safe thawing and storage, measuring internal temperatures to check deadness, preventing cross-contamination, and cleaning and sanitizing. So with measuring our internal temperatures, we do want to avoid raw meats or fish and undercooked eggs because they might not have been heated enough to kill off any harmful bacteria that could be on the surface of those foods. We do want to use a thermometer in the thickest part of the food to measure internal temperature because that thickest part is going to be what takes the longest to heat up thoroughly. When we're looking at the temperatures of all of our foods, our whole meats, seafood, and eggs should be heated to 145 degrees Fahrenheit internally. Our ground meats, ground seafood, scrambled eggs should be heated to 155 degrees. And why the ground meat versus the whole meat needs a higher temperature is that there's more potential exposure to bacteria for those foods because they've gone through that grinding process. So just something to keep in mind is that you want to heat those ground meats up a little bit more than you would with the whole cuts of meat. And then with our poultry products and stuffed meats and casseroles, we should be heating those to 165 degrees Fahrenheit internally. And we want to store our food in order of their minimum internal cooking temperature. And why we do this is because, if we're cooking poultry 265 degrees Fahrenheit and that goes above our meats and we're not cooking our meats to that 165 degrees Fahrenheit, any drippings from the poultry containing bacteria that can get onto that meat can then potentially survive the cooking process. So, how we want to order things in our fridge would be our ready to eat foods and produce at the top, so foods that may not be cooked at all. Our whole eggs, meats, and seafoods. On the next shelf down, ground meats, seafoods, and cracked eggs on the next shelf down, and then on our bottom shelf, that would be all poultry products and stuffed meats. So then safe thawing and storage. So bacteria does grow best between 41 to 135 degrees Fahrenheit, and this is known as the temperature danger zone. Foods that need to be time and temperature controlled for safety should be thrown out if they've been in the temperature danger zone for more than 4 hours, because during that time frame, the bacteria is able to multiply to a level that it's no longer safe to eat those foods. When we're looking at thawing our foods, we do want to make sure that we're thawing our food outside of that temperature danger zone or passing it through the temperature danger zone as quickly as possible. So we want to thaw our food under refrigeration. That's going to keep it out of that temperature danger zone. Under running potable water that's 70 degrees Fahrenheit or lower. That'll also help keep it out of the temperature danger zone. In the microwave oven and as part of the cooking process. Both of those are going to pass it through the temperature danger zone quickly. And you do have to cook the food immediately with if you do microwave it to thaw it. So then preventing cross-contamination. So cross-contamination is when bacteria from one product gets onto the other. And as I mentioned before, with those internal cooking temperatures, we might not be cooking some products all the way to kill bacteria if that bacteria from another product gets onto it. So let's say we cut up some poultry on a cutting board and then cut up some slices of steak. We're only heating that steak up to 145 degrees Fahrenheit internally, not the 165 degrees that we would be doing for poultry. Or if we are cutting up a salad after cutting up those on that same cutting board, that we're not cooking salad. So we could potentially be exposing ourselves to harmful bacteria with that cross-contamination. So what we want to do to prevent cross-contamination would be to wash hands and equipment in between handling raw animal products and ready-to-eat foods, using different cutting boards for different animal products. So usually people will have different color cutting boards for that. So it's easy to recognize which one's which. Clean and sanitize kitchen counters after preparing raw animal products. Avoid unpasteurized dairy products such as raw milk. We pasteurize our dairy products to kill harmful bacteria in them. And as I mentioned before, people with HIV might have a hard time fighting off any illness that could be caused by that bacteria in the raw milk. So just want to be extra careful and choose pasteurized, I mean. And then some other safety considerations is washing your produce thoroughly under running water with a scrub brush. So that just helps removing dirt from the surface of that produce. Using caution with foods like berries, grapes, and sprouts that might be difficult to clean well, so they might still have a lot of dirt on them. Toss out foods with mold. So the only food that you can technically cut the mold off of would be hard cheese. You would have to cut a 1 inch diameter around the cheese. And so why we want to toss out foods that have mold on them is because while there's that surface mold that we can see, the mycelium from the mold, so little tendrils from the mold, permeate deeper into that food. So you might see just a spot of mold on the surface, cut it off, but it's still that mold is present in the food. You just isn't visible to the eye. And hard cheeses are able to prevent that mycelium from penetrating deep into them because of how thick the product is. But in general, toss it if it's moldy. And then avoid buying dented cans and frozen foods with freezer burn. So dented cans, that can introduce bacteria into the can if there's a crack in them. And then with our frozen foods, with freezer burn, that's a sign that it had been time and temperature abused, where maybe it went within. Went into the temperature danger zone, and then goes back into freezing temperatures, which allows those large ice crystals to form on the surface of that frozen food. So what I'm getting at with that is that it can potentially have harmful bacteria in it. So just want to be very careful with both of those as well. So then moving on to symptom management. So for nausea, what we recommend is to mainly try to eat some dry foods that are bland, so as to not upset the stomach further. You want to avoid fried foods, sweet foods, spicy foods, and other foods with strong odors and spices, because they're just not going to sit well. We do recommend nibbling on those dry foods frequently, so that might be nibbling on some crackers throughout the day until your stomach settles. You do also want to stay hydrated, so making sure to drink water and other clear beverages such as Gatorade, and maybe even have some popsicles that you're eating to also help settle the stomach. Ginger containing foods and drinks have also been shown to help with nausea. There's many options available for ginger containing foods. I highly recommend getting some ginger chews because that just helps with trickling down the ginger into the stomach and not overwhelming the stomach all at once. And then keeping liquids to a minimum at meals, because you might fill up on the food and then the liquid, and then that just doesn't set well on the stomach. So then diarrhea. So what we recommend for this is to increase your soluble fiber intake. And so soluble fiber is going to form a gel in the gut. And so what it does is it helps soak up water into it. So think oatmeal. Oatmeal is a good source of soluble fiber. When you put water or milk in with it and let it sit for a while, it sucks up all of that liquid into it. And so that's what it does in the gut too. So it helps with minimizing diarrhea. You might also want to replenish beneficial bacteria, such as by eating yogurt or drinking kefir, which both have probiotic bacteria in them that help with managing the gut bacteria levels to also help with diarrhea a bit. We also recommend avoiding intestinal irritants and stimulants such as caffeine. So coffee is really not a great thing to drink while you're having bouts of diarrhea. Decreasing dietary fat, decreasing or eliminating lactose. So some people might become sensitive to lactose with taking the medication. So, trial having a lactose-free diet versus having a lactose containing diet and see how you feel with it. And if lactose is causing an issue, you do want to eliminate that. And thankfully, there's a lot of lactose-free options nowadays. So there's a lot to choose from still. And then increasing your fluids and electrolytes because we do lose quite a bit of water and electrolytes in our diarrhea. So we want to replenish those so that we're staying well hydrated. So then with weight loss, we want to add calories without adding bulk in. So a good way of doing that would be some of our unsaturated fat. So, adding in avocado, cream, mayonnaise, salad dressing. Something I recommend is to take olive oil and just drizzle a little bit of it over your food because that adds in that fat without adding in the bulk. You can also blend up avocado with fruit into a smoothie. Liquids and semi-liquid foods tend to go down a lot easier, digest faster. So that can also be a good way of adding in more calories with something that's going to digest pretty fast. Another option with our carbohydrates would be 100% fruit juice. With our proteins, we could add in protein powder, some of those low-fat cheeses, nut butters such as peanut butter, trail mix, and then some of our breakfast drinks such as Nesquik or Boost, to add in a little bit more calories to the diet. Eating more frequently helps as well. And just trying to maximize drinking calorie containing beverages in between meals, such as those smoothies, the boost drinks. And then if you are experiencing substantial weight loss, you might want to talk with your doctor about other therapies that are available for that, such as appetite stimulants. So then early fullness. So try to get small, frequent meals in, so about 5 to 6 times a day. Concentrate on solid foods with liquids in between meals. So when you're having issues with early fullness, mixing solids and liquids in the stomach is not going to be helpful because there's only so much room in the stomach for one or the other. So you do want to focus on having your foods at meals and then drinking liquids in between meals. Um, and still staying hydrated, eating lower fat, lower fiber foods. So with our fats and fibers, they delay gastric emptying, so they keep food in your stomach for longer. So when we're having issues with early fullness, we do want to limit those foods that are going to make us feel full for longer. Wear loose-fitting clothing. So if your pants or your bra is squeezing your stomach, of course you're going to have a hard time with that early fullness. So we do want to eat, have things that are a little bit more loose-fitting while we're eating. And then potentially eating, walking, and eating again. Walking does help move food through our GI tract, and could help with stimulating that hunger again. And then loss of appetite. So we want to rely on some of our favorite foods. Maybe ask a family member or friend to prepare meals. Sometimes the smell of preparing meals yourself can be a little bit of a turn off from eating. Um, going back to that our previous symptom, eating small frequent meals, so trying to get in nutrition where you can, keeping snacks handy for nibbling, so some of that trail mix, nuts and seeds, um, eating before bedtime. And usually I recommend, for if you're going to have a snack before bedtime, having something that's a little bit semi-liquid or liquid like a smoothie or yogurt, because it just sits better on the stomach, especially if you're laying down right after. And trying to make the most of good days. So trying to eat more on the days in which you're hungrier, to maximize that nutrition potential. Light exercise might help with stimulating appetite. And then, of course, you might consider appetite stimulants. And that's something that you'll want to talk about with your primary care physician. And I do also highly recommend talking with a dietitian to figure out a good eating schedule, and some additional foods that might be helpful if you're having issues with weight loss and a loss of appetite. So then changes in taste. So do recommend trying a variety of foods, not only your favorite foods, because some of your favorite foods might not be tasting right, while other foods might taste a little bit better. So just giving a wide variety of foods a try and seeing what tastes good, what doesn't taste good. try protein sources other than red meat. So sometimes red meat might taste a little bit metallic. It might make you a little bit nauseous. So some options in that case could be trying out tofu, tempeh, lentils, beans, legumes as alternative sources of protein where they have more of a neutral flavor to them. You might marinate your foods using sauces, um, using more and stronger seasonings to flavor them. Sometimes trying out tart foods also can help with breaking up the flavor of the food and just circumventing that change in taste. Sometimes adding a little bit of salt or a little bit of sugar to food also can help with that tolerance. And then another thing that you can try out if you're having changes in taste is to swish some warm water with a little bit of baking soda in it before eating. Sometimes that helps with the taste changes. And then difficulty chewing and swallowing. So we'll want to choose soft, nutritious foods. So that might be applesauce, beans, smoothies. We might want to blend or puree our foods. So soups and stews can go through the blender and be very tolerable still. We might want to add cream sauces or gravy for lubrication to foods. So that just adds a little bit of liquid so it's able to go down the esophagus a little bit better. In this case, we might also want to sip liquid in between bites of food to also lubricate the esophagus and make things go down a little bit easier. And then if you're having issues with hot foods causing pain, you might want to try out cold foods or foods at room temperature. And then, of course, we want to avoid alcohol and tobacco if we're having issues with difficulty chewing and swallowing, because they're both going to irritate the esophagus, irritate the stomach a little bit. And then lozenges may help with soothing the throat, making it a little bit easier to eat. And so that's it for symptom management. So looking at local resources, we have a few programs available in the Northern Virginia area. So we have the Nova Juniper program. And so there's clinics located all over Northern Virginia, including Leesburg. And they provide a variety of HIV AIDS cares. So they provide free HIV testing, pregnancy services for individuals with HIV, and prevention services. Loudoun County Health Department also provides HIV testing and counseling. They can also be a good source of referral to HIV and AIDS care in the area. They provide free condoms and educational resources. The HIV Resources Project is a Virginia program dedicated to helping people with HIV and AIDS and their caregivers identify appropriate housing options and supportive services that will help enhance health outcomes and quality of life. So they have a lot of great resources for housing and financial education surrounding HIV/AIDS. And then lastly, VDH, so the Virginia Department of Health, has a free self-testing program for HIV. So eligible residents of Virginia can receive an HIV self-test to take at home in the privacy of their home. And it's very fast to do. It's just a swab of the mouth, and then 20 minutes later, you have your results. And they also have resources available for canceling before and after testing. So thank you all for listening. I hope you were able to learn some new information or reaffirm some of the information that you already had. But I hope you have a wonderful day.